call the meeting to order. Got everyone here except the mayor. And Colleen, who's joining us by video. Are there any corrections to the minutes of the June 26th meeting? Any additions or corrections?
I will move to approve the minutes from June 26th, 2024 meeting.
All right.
Yes.
Second. Okay. Got a motion and a second to accept the meeting of the minutes of the meeting of June 22nd. Is there any discussion? Any comment from the public? There being no public comment, no discussion, we'll move to a vote. All those in favor say aye.
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 Opposed, nay. Motion passes 4-0. Let's take the next item on our agenda is the local opioid activities report from public health. And we've got a written report from public health on here reserved. Is there anything that staff would like to bring up?
We did reach out to Kelly McBride, Criminal Justice Services, and because of her being out this week, she was not able to provide a written report, but indicated she would get that to us next week and we'll send it out to the group.
Okay. All right. And the comments from the public health, I haven't had a chance to read them yet. Does anybody, do you have anything that you wanted to add from that?
What is it that you're looking at?
I'm looking at the last page. I think it's the last page on here. It's a memorandum from public health.
So I can speak a little bit to this, I guess, okay. But public health does employ a opioid prevention specialist, and I actually just approved the grant today for them to move it forward to a commission meeting to increase funding from a part-time, half-time to a three-quarter-time position. And I know a lot of work that person is doing is working across more than just Lewis and Clark County, but our adjacent counties. Naloxone distribution, trying to get that out to all those places within the county that use it. And I think it's just a lot of outreach with partner organizations that are also in the opioid prevention and treatment arena. So that's all I can speak to with respect to a little bit I understand.
All right, and then other than that, we've got a written report here. We can read later time if you want to. All right. And criminal justice services, we say they're not able to be here, so we'll hope maybe at the next meeting we can get a report. Yeah. Let's talk a little bit about communication process, contacts or requests. Any thought there? Is there staff have ideas about what you like to post
Mr. Chair, members, so this sort of percolated up to the top as our last meeting, and today there have been several instances in which applicants for these funds have reached out to committee members specifically. Some maybe all of you received those communications, some maybe they were more targeted. I know Colleen received one early on that was seemingly directed specifically to her. So recognize that this is a committee that meets quarterly, that potentially your capacity as committee members to speak on behalf of the committee would be limited, given the frequency of these meetings, to respond to any questions or receive solicitations. I'll put it that way. We had one application that reached out that said, "We've got a deadline and we would like to know your answer, and here's why we think we're great." So we kicked this back to the moat staff folks and just said, "Hey, how are other people handling this? This seems a little unorthodox. What's best practice?" And one of the things that they suggested, other groups, they don't seem to be thinking that they're having as many issues maybe as we are, but they offered potentially that we could take your email addresses off of the Volt website, which is, by all intents and purposes, making our email address public. Those entities to see and to reach out to you specifically, and have more of an administrative point of contact with myself or Anne or both, so that we could receive those inquiries, questions, respond if appropriate, and then provide them to the committee at a single point in time, so we all have the same information, are able to make the same considerations, and or that you as a committee could decide, those types of, like, a solicitation isn't going to be an appropriate response or an appropriate communication, and that the committee will already communicate with applicants at the time of your meetings if you are requested to come forward because you are a finalist or a project of consideration for the committee. So I just wanted to include that item for you all to discuss, to figure out how best you'd like to handle that and what feels manageable. Anna and I are open to being that administrative point of contact if that's what the committee desires.
Thoughts?
For the record, I received no communication from a single applicant, so from another entity. Our names would remain on the moat site for public information, but our contact information in that regard wouldn't be there. It would just be to contact the Lewis and Clark County Metro Committee. It would be a generic email or some. There would be a way to communicate.
Yeah, they would. I think you could leave your email addresses if you wanted to, and ask them to put direction to contact us if they have any queries. If there's a question or concern of transparency or legal to reach out to you, that's totally fine. I think the moat folks said more or less it's up to us how we want to direct people in that regard. Their stance was that they can't answer questions specific to the priorities or desires or timeline of any given metro area or other abatement area. So
it could also just be our practice, because they could reach out to us any other way. Your email's public, mine is, yours is, that we just forward those on to you and allow you to then respond, or we just don't play a part in the responding, just as we aren't to respond to one another in the larger group. We would do the same to just respond or forward that to you all if we received it.
I wouldn't mind having just a central point for it to go to.
Sure.
And then it can be distributed to us as needed. Any other? I don't think that would be a bad thought. Use one of your emails to do it, and then if you get inquiries, you might be able to answer the questions simply. If we get somebody who wants to put an application in, then it would come through. Does that sound all right to everybody? That we would have a kind of a central place to go to staff and then be sent out.
Yeah.
If that's agreeable. I don't know that we need a motion. Let's just make that a practice. Okay. Okay.
So list your names on the website, but remove your emails, and then add we can reach out to IT to see if we can even get a, see Metro Region at email created.
Yeah.
And then I think those could forward to both of us, auto forward, but then we're not actually attaching individuals' names to it. So.
Yeah, and for your own sake, that would probably be good too.
Yeah. So I'm not, yeah, right.
I will say my knowledge of how IT sets up users is that potentially that would need to be built.
Oh, that's a good point.
There might be an associated cost for setting up an additional. Well, we could,
yeah,
we can check that out.
I have a solution potentially there. I have a grants app that I don't use very often.
I also could check to see, we have with Amy, if she was able to receive those, because her email address is just city clerk at Easttown, so there's no name associated with it. And she could forward those as well if you want. So if you want to check yours, and then if that doesn't work out, I can ask Amy if that could be,
okay,
if she's just to pass through to forward any information on to you all and then to us if necessary.
Yeah. Okay. Sound good?
Yes.
Colleen, any thoughts? Hello?
Sorry, I had to unmute and I can't find the mute and unmute. And so, yes, that sounds great.
All right.
Allowed you to talk. So
Okay.
Is there an appetite for this group to be receiving those as they come, or do you prefer to sort of receive that information, provided it's not a question or something like that, but it's more like what we received from the North CMS project, which was more of a solicitation. Prefer that we hang on to those and present them at a meeting, or I just don't want to be making an assumption, I guess, in terms of how the committee wants to, how often you want.
I imagine there's going to be huge numbers. Like if it maybe as they come right now.
yeah, I think
That's
for transparency reasons, because we meet quarterly, so that they feel that their message is being heard and reviewed. And then if we respond to you all with any feedback we may have, depending on the meeting.
Yeah. All right. Do it that way. Okay. Anything else related to the communication process? There's some correspondence that we received on July 19th and 29th, again on August 8th. Everybody had a chance to kind of consider those things. Let's take a quick look at the July 8th item.
One of mine changed the date automatically to today when I printed it, and so I'm trying to which one might be.
The person context if it's helpful.
Pardon?
Person context if it's helpful, Mr. Chair. This particular correspondence came as I think sort of like a quarterly, this is what's new, unsolicited by us from the vote. The rest of the correspondence in this packet are sort of questions that we posed to them or items that we requested from them.
So that's just kind of general information. Then there's one dated the 19th, responding to our questions. Has everybody had a chance to kind of consider that? Any are you satisfied with the responses? I guess some of it just cut and dried the way it is. And then we've got a like 19th letter, which more really responds to the questions. And then what is this, July 29th letter.
Mr. Chair, if I might, the that you're looking at that we received on the 29th is a copy of the state advisory committee is using for building their agreements, because we were curious about what criteria they were going to be using to evaluate applications that come from the local abatement areas for approval. So that's the nature of what that document is.
And we wouldn't be seeing anything differently because we're not doing contract management anyway, correct? The one question, I don't know if this is the place to ask it or not, but for the funding requests, I still don't clearly understand how the funding works if it's not just us. And am I the only one that's still confused about that process?
I think I have some of that sort of.
I get it if it's strictly us, but there are few of those. I don't understand what we're to do with the full statewide and the multi-region.
I would make the assumption that if it was a multi-region, that each region would have to decide how much of their allocation they were willing to contribute to that effort.
And on the statewide basis, it sounds like, and you may have an answer for this, but they're making that decision fully. We have no part in that, but it will take funding from our district.
Mr. Chair, who requests my understanding is that the last we heard from the MOAT was that they were going to table the statewide requests because there are still areas that have not put together a governance committee yet. That said, should a local area want to entertain the regional requests, that's acceptable. Was that your understanding, Anne?
That is my understanding, and that they've now gone back to the multi-region applicants and said, please break this down for each region that you're requesting funds from. So now we can make at least an understanding of what requests are making specifically to our region. But it's not clear to me, I think any of us, the other regions that they're applying to are going to respond. The project's even viable if they don't.
9 out of 10. Well, if enough say no, is it really viable for those that say yes?
And how you work through that.
And I guess one of the things I thought might happen is if someone revised their financial plan, it would go back into our queue, but it doesn't change our queue. So are we to just how do we know if there's been a change to the financial, any portion of their application, because it doesn't like go back into a yellow status of something changed, or it's still just green or red. You either did it or you didn't, and if we already did it and then they changed something, how are we to know?
That's a great question. Excellent question.
I'll have to go to them with so many questions. That's why I'm apprehensive to ask. Like, am I really missing something here?
That's cool. I LNC.
I think you're absolutely right.
I think we're on the leading edge. So
Leading edge of confusion.
pioneers of
For the first time in my life.
You're pioneers.
I sure wish you was something clear.
I think it's an excellent question.
Yeah. Did you get all of those questions? Okay.
And you guys, as I don't know, this kind of fits in and talk a little bit about those general things. I personally, I'm kind of of the notion that just hold off on anything whether than a general request. and to really just talk about the ones that are focused to us and are part of our local community project.
And then if we're out of money, we're out of money.
Yeah,
Is that?
Yeah.
I'm kind of feeling the same way, but some of the larger statewide, I had some stronger feelings on. But I thought this is a really good opportunity for the state. But I feel the same because, and especially as October 1 rolls around and as budgets are finalized, this week now, it's already kind of a hindrance because budgets are even finalized for a lot of folks. So I would agree, though, that if we're to make a decision, we do that on the local Lewis and County only, and then
So
we have left.
if I understand correctly, just the two still, they're strictly for us. Everything else seemed to be an application for multiple districts. Unless I missed it. Colleen, any thoughts? If there,
Yeah, Mr. Chair, I agree with you. I think we should just go forward with the Lewis and Clark Metro. There are some statewide ones that are absolute no's to me, but it's obviously worth a conversation with everybody. But yeah, I think we should just go ahead with the two local ones that we have. That's my thought.
have discussion and potentially make a decision on those. Okay. All right. Is there anything on the material that the letters we've received that anybody wants to bring up? Anything else?
Mr. Chair,
Yes.
just one additional piece of information that might be helpful that I'm sure is in there, but maybe buried. You did ask a question about, there's funds that were allocated to the state, both for DOJ and DPHS in the past. Both of the information as to how those entities are choosing to spend their funds. But my understanding from the MOU originally was that the DOJ funds more or less would cover their attorney fees related to the negotiation of the MOU, at least initially. We don't know, and what they were unable to provide is any additional information as to priorities for the state. One of the questions that we posed was, state has money, there are statewide projects, state willing to put some of their funds towards these statewide projects as opposed to sort of having the local areas sort of carry that on their backs. We don't know. Or the Moat folks did not know at that point.
We don't know if we're to award, say, both of these projects, and then those two statewide are taking some from our pots. Is that what you're saying? No. Okay. Thank you.
Sorry, Mr. Chair, can you revise the pots are separate
Okay.
from the
state has
initial
its own
allocations. Correct. That's correct.
All right.
But we're safe. If we're just funding local, we're safe. We won't be getting in the way of state funds or kind of cutting ourselves off.
Guess we'll see.
There we are.
Exactly.
Let's take our
Odds are.
Mr. Chair, committee, they did note that if abatement regions want to provide input to DOJ, DPHHS, we would be able to do so, and that should be directed directly to those agencies.
Not. That was not a responsibility they wanted to take on.
To my knowledge, and I have asked our public health officer, Brenda Neiman, if she has heard anything, and she has not either.
It's on the statewide.
She's on the statewide Moat Advisory Committee, but she has not heard anything.
Okay. All right. All right. So I guess if that's agreeable to everybody, we'll move towards taking a look at the two that are local. Maybe we can do that today and give some consideration to them. And we did have a third on our item number 6, which was the Montana methanol project, but that's again one that was sent out to everybody. it's probably, it's been a positive program in the past, but it's more of a, many regions are statewide for the request. All right, anything else on 5? If not, we'll move on to item number 6. And do we have they call it a compiled report about how it went felt?
Yeah, I guess we haven't seen each other's scores. Not that the scores are definite by any means, but
I,
I, Mr. Chair of the committee, Stephanie McGowan from the Road indicated that she could compile this. I don't think it's a report.
oh, I thought it was a report that was up there.
I think no, it doesn't auto-generate. I think she can see what each committee member did put, and then she can put it into like an Excel sheet, our scores.
do you all have your scores? I guess we don't have the mayor's scores. Yeah. But I can pull mine up.
I think I want mine along too. And I just today made a change on it. It didn't take much long.
Were there any changes to those two fiscally or any other way? Because I reviewed them quite a long time ago and haven't gone back in to see if there was a change. Do you know if those two local had any changes to them?
No, I don't believe they did.
Although it'd be very hard to tell.
You're absolutely right. That's an excellent question. Like, how would we know?
Or can they? They maybe once it's in, it's locked. But by the sounds of it, there could be adjustments, and then I don't know.
Do you want to talk about what your scoring is on those? For instance, let's look at Lewis and Clark County Sheriff first.
It'll take just a moment for me to pull the.
Terrible is if you go to the ones that you completed, click
It's just gonna take me a minute to get for the computer.
it'll give you a response on your respond.
So if we were just, it also, as I'm doing this and for conversation's sake, if we were to fund both of these at the level from when I reviewed them, unless something's changed, just to note, that would be 52% of our annual allocation. So we would have just under half left for the year to do whatever that means going forward. I did have concerns, and I guess if this is still the time to talk about it as my computer slowly trying to open, is I had some concerns with both of them and similar. The Helena Public Schools, there was a lack of data on the number of students at risk and a lack of data for outcomes to prove their success, which is a key component of our metrics. The ACT is another is a lack of clarity on the full role of the social workers for their purposes of opioid prevention, not just for their purposes of social work with students. The same with the detention center. I think it was mentioned, and I apologize, during that last meeting, I had food poisoning and was just trying to not be sick. But I was listening in intently, but was that there was no dissemination of who had opioid use disorder, that they were essentially treating every single person, which I can't imagine is accurate. But did they make a statement that was essentially they treat every single person?
If I remember correctly, I kind of heard like it's such a big issue, we have to treat everybody. It felt a little loose.
make inquiry with everybody and try to find out whether they,
Sure.
yeah, and then of course, and I remember from their comments, a third of the 164 inmates that were in there that particular Monday had a substance abuse disorder, but it
So-
wasn't necessarily opioid.
But the numbers they were providing us as for the rationale to me, the medical provider was for all,
Mhm,
correct?
mhm.
So I had a hard time clear that you understood. I think you asked questions about that specifically to Colleen, if I remember correctly. I was
Yes.
kind of about that.
And I'm looking at their application and it says that this will help pay a medical provider to provide primary care and urgent care needs within the facility. And yeah, they did not have it broken out by opioid use disorder. And the way that the deputy explained it was they can't just provide the service to a handful of people because that puts them in a legal situation of not providing it for everyone.
So that goes back to then the offer. That's why it's offered to every single inmate, regardless of their infraction or reason to be there.
That's correct.
Even if it's a no and then they move on, but they're still number counted as offered services.
Yep.
Okay.
Mhm. What are your thoughts about that? Does that anybody have a thought of how that?
I wish that would have been part of their rationale more than us having to connect the dots for that. But I could see that. I just have a hard time, just like with the Helena Public Schools, of providing funding for something that is also for many other things that's not the intention of this funding. And it is specific, but it is specific for certain things, not and benefit the organization otherwise, which of course it would. But there was just no cost share option or opportunity for this either, where that would make it a little more palatable, I guess, for me. Or it was, this will pay for 66% of this individual, not 100%.
Mm-hmm.
So,
I agree.
not to say I wouldn't agree with funding it.
Yeah, and when we're tasked, this is opioid money. It's supposed to be going to take care of that. There's going to be some spillover.
Sure.
I would think. I don't think it's an exact science, but what does it fall within the parameters of what we're allowed to do?
Yeah, one of the other things that I've highlighted in here is that the program will also reduce the costs of medications, but not just medical assisted treatment, but all medications, which that's clearly out of the purview of this.
Mm-hmm. So they're looking at over 5 years, $576,000. Well, $15,000 a year, roughly. I suppose it's possible to say, hey, we're going to only fund part of this. But what's your thoughts?
One of us asked the question about what is this actually buying? And was it one person's time 1 day a week? What was the number of hours? Was it half time? Or
It was $60 a month per inmate.
The person is being paid.
The provider is being paid per inmate, which is also my question. This is a 5-year proposal, but they haven't built in any. Is this provider going to continue to just accept $60 per inmate? What if the costs go up? Then what happens?
I guess I was of the understanding they wanted to hire somebody to be on staff.
It wasn't a staff member, it was a contracted individual.
physician or PA?
Yep.
it was a PA, but it was a contracted individual. I do remember that portion of it.
All right, I took it as being a staff person being added.
Said it was, they had that in the past, but it was too expensive, and they have a provider that would have the capacity and ability to provide these services on a contractual basis. Am I making that up?
No, I think that's what I got.
My understanding is that they converted that one staff position that they had into multiple nurses, certified nurses that have the ability to do.
They couldn't give them, they couldn't do certain things though, because they only had nurses, where they needed an individual that could
They
be
had
there.
to have somebody that's either a physician's assistant or a nurse practitioner. Or my notes.
And I do think the contract, I mean, that makes me feel better too, because it's not as long term. If the money goes away next year, it's not a person's full job that's going away with it. It seems a little bit more responsible, but
So if we're looking at $115,000 per year, how many hours of time is that?
1900.
The way they're talking about evaluation is they're looking to reduce the number of transports by 50%. So it tells me this person's not going to be there all the time. They're still going to be transporting folks. I really swore I heard it was like 1 day a week or something. It felt like a really rich contract to me. I was thinking, I'm in the wrong business.
So it appears they got this $60 a month per inmate. They multiplied that times 160 inmates on average, so treating every single inmate.
there were no other costs like that broken down.
That's treating every inmate in the detention center every month. That's how they got to that 115.
They would have actually, I don't see it remember the number of transports. Like, give us some dollar amounts here. Like, what is the cost of the care? How much is the medication?
And the concern too that I have with that, and now I have it up here and I'm reading it, is yes, it's $60 a month per inmate, but if it's a no, the person, whatever their issue may be, was completely unrelated. We're still paying $60 for that person.
Yeah.
But then if someone needs more intensive treatment, they're also $60.
Or any additional costs will be paid for by the, if it's built in. So that's the point where the cost could exceed what we're paying.
I guess there's no way to know if we can do this, but if there was a parameter more around it, if an individual says no, they're not included. If an individual says yes, I understand the $60 a month, but I don't see how that's financially viable for a provider. If they're giving intensive treatment to one person for $60 a month, that's not financially viable. So I guess that's where it comes.
So I'm reading back through this again. If an inmate is a candidate for the MAP Bridges program, they must be transported for their initial appointment and follow-up appointment. So by having this provider there, they don't have to be transported. I think that's where a lot of the savings comes for the sheriff's department. But again, it's treating every single inmate, regardless of any kind of use disorder.
And I remember that was part of the conversation that was there, was that transport is the toughest part.
I remember looking at their figures, they said they had 2,600 different inmates last year. A third of them had a substance abuse disorder. So that's 867. So 867.
But those are all use disorders, not just opioid.
That's right.
That only equates to $52,000.
52. Yeah.
I want to make a note, Chair Committee, that I'm looking at the eligible uses that are part of the settlement, and they do allow for co-occurring substance use disorder / mental health disorders, with opioid use disorder certainly being specifically called out, but substance abuse disorder, mental health co-occurring is also eligible.
Okay, so that would it wouldn't we wouldn't be giving money for something that was technically illegal to do.
And I don't know if we have to split hairs with opioid use disorder versus non-opioid use disorder,
Okay.
because that would be very challenging.
Yeah.
Okay, now I see how they got the 150 exactly.
I assumed everybody needed
Once per month
for every.
for every single individual. Yeah. Sorry.
I do
Yeah.
too.
Well, I think the other question that we should try to ask ourselves is, if we invest this money, are we going to move the needle on reducing either opioid use disorder or overdoses?
I see the long-term systemic benefit to this for a lot of things, for the transport issue, for the getting them the services that they need, for the monthly, for those that need it. But I don't understand how it's taking into consideration each inmate, every single inmate, regardless of their situation. And is it going to create I guess, for the detention center or for the provider, if we are paying them per inmate? Of course, that's the way this model is set up. That worries me that kind of, you're incentivized to have more, whether they need it or not.
Yeah.
And I think that it's understanding who actually needs it. But they don't really have a way to determine that until they do the initial treatment. And there's no way to pay for that, especially for those that don't have insurance, because then they go to the facility and don't have insurance. So that's why they have to transport them. I have an inkling, and I don't know if this is just me, to agree to an award that's decreased with the understanding that they're more diligent on the front end, that if an individual does not have a use disorder or mental health concern, that then they're not part of the next 11 months that they may or may not be at the facility. But then another person could replace them just as easily the next month. So I guess that's where I can see why it's so difficult to narrow exactly what that number is. Yeah. Sorry, thinking.
Nicholas.
I'm done, Colleen.
I was just going to say, I think the sheriff or the deputy had mentioned that they can't be specific, like, oh, we're just going to give this service to X amount of people, because then it sets it up for a lawsuit that not everybody got. And it looks like by having this provider there, it's for entire medical care. So everybody would have to get everything.
It's all or nothing.
I believe so.
Is there would it be possible for one of you to give a call over there and just make sure that we're right about it being per hour thing rather than adding a staff person or something like that? Is
A
that,
contractor versus a,
yeah, or is there another question that might be more appropriate to ask?
Well, it says a local provider provided a quote for these services at $60 a month per inmate. So that would be that would be,
$60 a month per inmate.
yeah, but that they provided a quote. So that would be a contractual. I do remember that part of it, that it was not a staff member, that it was a contractual individual, and they already had someone that was interested.
Yeah, I would like to know, like, how much time is that buying, like, on site? How long, how frequently will they be there for how long? Because kids make good money, and so $15,000 is actually pretty low. So it's not full time. We know it's not that. I would just like to know how they can be. 160 is, I mean, what, I don't know. I have so many questions. What is their turnover in terms of inmates? Because 160 people, it's not the same 160 people for the month.
A lot of them are though.
Are they?
If you look at the inmate roster and the time that they've been there, a lot of them have been there for months on end, if not a couple of years.
You just look at the roster at night.
Sometimes it's interesting to look at.
day.
Yeah, it does.
Um,
I don't look at
Oh, that's
it.
really, yeah.
But it tells you how long they've been there.
Is that, yeah, so that would be good to know. It's just, is it feasible that this guy, I mean, what's going to happen? I guess it says that the county will pick up any excess. Could it be that he's saying, well, I'm going to see 160 people, individuals a month, one time? That's what this buys them. Well, if they exceed that after 2 weeks, I mean, if he's just cranking through folks, then is it back to the county, driving people back and forth?
Well, and what was the last? The sheriff just told us what was the last enrollment number at the. It was 200, wasn't it?
yeah, but then,
But not all of them are there that entire time.
yeah, actually I heard, I think 146 last week
Oh, okay.
because there's a leg and when tried getting transported to like the state prison. And so a lot of county jails, I understand, detention centers, holding inmates before they're transported to the state system. So it actually just quite a backlog on that, I understand.
164 as of today.
State prisoner.
Yeah, but then it was
As of today, there are 164.
Weeks ago, I think they were up to 200. And I think pretty consistently 150 plus.
yes.
A handful have been there since sometime in 2023, and many since early 2024. Just as I look through this, so
There's no way of getting an average.
put it into Excel.
Um,
So, what would there be any? Would you want to try and contact them and ask a couple of quick questions, or not?
Also, with that, kind of here are some questions we have. Is a way to determine what their metric is because they had their what are they measuring this on? How are they going to succeed? So, and because we're only granting for 1 year at a time, we kind of agreed on that, didn't we? That we're only granting for 1 year at a time. How do we know that this is successful to determine whether or not we're going to grant it next year? Back to their evaluation, transport numbers. The goal will be to reduce the number of medical transports, but that's not getting at the concern that we have for opioid abatement. That's just a goal that they have. Reduce the amount of waiting time and approval to appointment by 50%. Reduce the amount of medical expenses billed to inmates by 50%. But none of the evaluations, they're strictly for their own benefit, not for the benefit of what this grant's purpose is.
Yeah.
And so I would want to see as well and maybe they can update this and be our test to see what happens if they update it, is within their evaluation method, what are you gonna do?
Yeah.
To decrease, and then if we go back to that list, let's maybe exhibit E. Wherever exhibit E is, if it gets back to some of the concerns of what the grant is focused on.
Yeah, I guess one of my concerns was how do we know if this is successful?
And not for their own financial concerns, but for the concerns. So our next meeting will be end of the year. So if we were to have these questions for them, we wouldn't have an answer for them in another few months. Unless we called another meeting. We could maybe do a quick remote meeting to hear the answers if you were all able to send it out to us, hear the answers to your questions, and then we could meet with an action item of not.
Better approval or whatever we would decide. I don't know if even if you could reach them today, I don't know what, it's a long shot, but it would be like, it's worth a try.
Get them on the horn.
Yeah, so Captain Gray, I'm blanking on the nurse that was accompanying him that day, but I can look it up in minutes.
I'm zoned out, but they're saying reducing things by 50%. I'd like to know where we're starting and where we're going to end. How many visits? Give us a visit number, maybe last year's or last month's or average or whatever, and then give us another number. Because right now, just saying you're going to reduce something by 50%. Sounds great, but what if it's only 30? Or what if it's 300? Or, like same thing for the amount of medical expenses billed to inmates. Anytime they say reducing something, I'd like to know from what to what. This is
Well, it would almost feel like you're eliminating transports here.
That would be
yeah,
a goal too, but that again is a financial benefit to them, not the grant is
Right.
not
Right.
to benefit the sheriff's office.
yeah.
Because I think with every transport, you've got to have two people. Or,
What's the time of that?
yeah,
In general.
yeah. Fitting schedules where you just have somebody coming in and taking care of it right there.
It's like $150,000 a year buy with additional transports. But the idea that these inmates are getting saddled with all these medical care, but again, we don't know how much that is. It says we want to reduce it by 15%.
Yeah, not an average of to an average of or something to that effect.
Yeah, exactly.
I guess could be very different if they have hepatitis, which is so costly to nothing.
I somehow got it stuck in my head that they were actually trying to fill a position and then do an hourly.
Maybe that's because they've had a position
Yeah.
and they moved that role, but now they're trying to go about it not as a employee, but I don't know, maybe that's right, but I could be wrong too, Commissioner, but
I was not able to get from Captain Gray just now. I was gonna have him just jump on, but
yeah.
No, that's fine.
I left a message that we'll be in touch with some follow-up questions.
Okay. What is the feeling that we are kind of positive about this one? Did somebody have but we'd like to know, get some ideas of how we judge whether it was successful or not? And,
I can see the benefit. I think that they have the ultimate outcome hope is strong, but they went about it from the benefit to the sheriff's department, not to the benefit of the inmates. And that's what all of our questions are turning to. The goal is to reduce people needing these services. How are you doing that? Not how are you benefiting your budgetary concerns that you have, which I get. But so I think it has there's a strong opportunity. They just went about it in a way that didn't fit the narrative of the grant requirement. They had an
I-
4%, but I was when I looked at the way it was reading, I could see a number of it fit almost all fours in the way I read it. But talking about it makes me want to choose that. Maybe
What's your percentage score?
84.
I was at 72. And I
That was at like 64.
But I was thinking about it. It has high impact because it impacts every single one of them. So I was when I look at the impact outstatement, and then it addresses an identified use, it has potential impact. I think I could change mine because after talking about it more, it was one of my higher scoring ones that I can see some of the holes.
Colleen, can we ask you what your score was?
I don't have it written down. I mean, I think it was maybe in the 70s, which I'm not real fond of their scoring because even though their scoring was high, it may not fit what we're trying to do with our county. So I'm not putting a ton of weight into my scores when I make decisions.
I think we were all fairly positive about doing something if we can get a few answers. Is that a fair comment? All right. All right. So if we can get some more specifics on how we can judge how effective the work has been done at the end of the year, we want to redo it or not, and maybe the specifics about how much we want to give them. So, Sarah,
Yeah, Mr. Chair, as we, Commissioners or committee, as we go through this, would it be preferred to ask them to reapply or adjust their existing application, or just to get these answers to the questions we had? Directly and pass them on to the committee.
we need to put it into the application.
Okay. If there's a way to revise, if not,
Yeah.
resubmit a new one. So,
I think it needs to be in paper.
Mr. Chair, I agree because that's what the moat is going to use to build that contract. So I think that is
Yeah.
going to be really important too.
so if they can't adjust it, submit new.
Ask that they provide like a language they would actually use for the contract with the provider, like you will, or this much money, you're gonna be on site X number of days, and these number of hours, see this many clients minimally or maximally. Would it be okay to ask for that?
I think that would be great.
I think that would be, yeah.
So the scope of work.
Yeah, exactly.
What would, you're kind of, I've been around the industry a little bit more. What do you think the fair hourly figure is?
Gosh, I mean, what's the starting typically for a PA right out of school is 150,000 a year. So whatever that is divided by 2080 or something. But I mean, but that's low for a new graduate. Well, for contract workers, he's got to pay taxes on all this, so he's gonna have to pay 40% himself, right? I mean, he's kind of a 1099 employee, is what it's sounding like. So he's going to be responsible for taxes.
Unless he's billing it through a practice zone.
But that's what he's doing.
because it said a local provider, and if they're a PA, they're someone.
So the 60s is kind of low.
But if they're doing it on site, they can run them through
Yeah.
somewhat. I don't like to, but and especially if there's a no, they're pretty quick.
They're getting people. They're getting people identified, diagnosed, instead of maybe waiting for 2-3 weeks to find the staff to take them out. They were done faster. I think that's a positive thing.
I don't know. I'm just taking the 115 and just $200 an hour gets about 575 hours, which would be through the year about 11 hours a week. Potential. So I would just like to get a breakdown of that. What do we actually pay for? Because urgent care too. It said urgent care in that thing. We're all going to be on site once a week. Urgent care is like kind of now, right? I mean, it's not like we're going to defer somebody 2 or 3 days to see this or till next week when someone comes. So are we really saving money? from that? Keep saying on-site provider. Like,
concept is that we're gonna have them for on Tuesdays and Thursdays or something
that's
like
kind of
that.
what I was
Yeah.
thinking. That's why I thought I heard it. I wish I'd taken better notes when they were here because I'm pretty sure
It is recorded, I guess. Go back and watch it. It's good exercise, but these questions were not part of. They were not part of their presentation.
Anything else? Any other questions that you would like to ask?
No, I think you covered it all. I mean, well, as far as outcomes, maybe if we could get a report at the end of each year of how many transports there actually were, so that we can find out how many inmates are actually getting MAT and that the money is going towards opioid. And then I don't know, can we just say we would fund it for a year or two, and then if it's successful, expand it or, extend it?
I think we agreed at our last, when I was here last, that we would only fund for a year all applications.
Mr. Chair, I believe that's actually how the vote has
Okay.
set up as well.
The most has it set up that way.
So it's a one-year contract with potential for renewal. Okay.
Mr. Chair, if I might just get some clarification. So I think it's a possibility or it's an option of the committee. We don't have to award anything this quarter, or as we move forward, you can look at the school district. It sounds like maybe there's questions related to that project as well, but if the thought is ask them to reapply with some additional information, then we can let them know that they will get considered in the next quarter. We would be able to communicate that to the vote, if you so choose, or we can try to, set up another meeting or what have you to try to have that happen in this quarter. Do you have a preference?
Anybody? A thought? What do you all think?
I would prefer if we could get answers and we felt good about them, that we could get money out the door sooner than waiting until another few months. And we start solving, we've already been delayed by a lot, and not because of our own doing, just by the nature of it. So I would rather get money out the door if we felt secure about the grants. But even then we could meet briefly online or some way to approve, deny, and move on from there, not a full discussion of the grants again.
Yep, I agree. I think I feel like we keep kicking the can down the road. We need to you know,
No.
do
Okay.
something, make a decision.
Okay, so you want to take a look at a week, 10 days? What are you thinking?
So I'm re-reviewing the MOAT's response to us. It sounds like they can amend and resubmit their grant application, but the MOAT has not actually done this on their end yet, so there might be some hiccups for us to work through for the first ones. Maybe a deadline at the end of the month, September 30th, for the applicants.
I was gonna say sooner than that. Give them a couple weeks.
So that
Give us a couple weeks.
the next meeting was going to be in mid-October, wasn't it?
Yes, I think it's in the schedule for October 15th, 16th, or 17th.
So if we were to give them 2 weeks from today, that's the 25th. If we were to give ourselves 2 weeks to meet sometime around the 9th, possibly to deny or approve, which would give them time to then give, because they have to get the final approval, right? So that would give them time before that meeting to give a final approval on if we approved one of them.
That sounds that good with everybody?
Do they need any lead time? Have they said that?
They have, I think it's about 2 weeks.
Within that, so that wouldn't work.
A week before mandatory call for the MOAT advisory committee to see recommendations. Don't recall this.
Well, if they, I mean, most folks send agendas out of the weekend.
I do recall them giving us kind of a timeline of lead time, but I can't. 1 or 2 weeks probably.
Should we shorten it up a little bit? Request response in a week, and we get together.
Are you all able to get a notification out today or tomorrow? Do you have that ability? The questions to the folks.
Yeah, I have a little bit more concern on seeing how it's going to work for them to amend their application because that hasn't been tested yet. Why don't you reach out to? I'll have to reach out to Stephanie, which I can do this afternoon after this meeting, and see if they tested that since she wrote this back in July, or see what kind of process that's going to be, and if it looks like that's going to be pretty open for them to reopen the applications. And I think we could get this list out too.
We do a 20th
Yeah,
response by, and then if we were to do a meeting by the 4th of October, then that would give them almost 2 weeks before the 15th meeting. So we're kind of almost too close.
We'll say we have taken my turn trying to get these folks in the room in that window. We might want to look at a dinner even Wednesday because I'm fairly certain that I, at one point or another, had every Wednesday between now and their proposed meeting on the table, and this was the only date that people could be in the together. So, I don't know if there's another date.
Before the end of the month. Fridays are not too bad for me. I don't know how that is for the rest of you.
So for me, especially if we're doing a remote meeting.
Early, the first 2 weeks of the month, we do meetings, remote meetings, one in August. Friday, the first 2 Fridays are not good for me.
Friday morning on the 27th.
Friday morning, the what?
It would be Friday, September 27th.
It's for me,
I can make that work.
I can make that work.
I guess we're not doing it.
The time preference for the 27th?
Sign
What time?
10? I do have a 10 o'clock, it's 10 to 10:30.
10:30 on the 27th.
Just make it till noon. That works for everyone.
Any more questions on the sheriff's office? We can cover before we move on to the next item. Okay, let's go with what we've got and see what, and then we can make that work if they can get back to us. And let's move on to the Helena Public School District early identification referral project. Any thoughts here? Let's talk a little bit about where everybody was rating this one. I had it rated after considering that I had rated it 8.
This one rated lower than the last.
Mine was higher than the sheriff's one, but very close.
64% as well.
It's for
Everybody was fairly positive.
Just the lack of clarity on the role that the two social workers would be doing. Is their role to provide mental health benefits that the school district can't afford right now? Or is it to prevent opioid use? And that's where I struggled with what, yeah, they might, or here's how they will. So
A little bit about what the district's trying to do is they are trying to build their internal mental health infrastructure. As I guess some of the other programs traditionally around the CT and some of these other things they've kind of pre-configured themselves. So I feel like this is more of an umbrella blanket approach that they're trying to create.
So I'll give you a little context, and I don't know if this is where Lana was trying to go. Back in the day when the school district had $5 million to do a bunch of stuff, they had hired, they're called project success counselors. And there was one in every high school, in all 3 high schools and the middle schools. And they provided, it was just kind of an extra counselor. It was very successful. They stopped a couple suicides. And I don't know if that's where Lana was trying to go with this.
I will say that their evaluation of it does have some good metrics that I think are good for us to know. What I don't know though is their plan is to establish metrics to measure. And I struggle with that through a first year program if we're to fund it of you should know what you're trying to accomplish, not use this money to figure out what you're trying to accomplish. And so I guess I would like to know more about what they're that now, not spend a year and this amount of money to figure out. You need to tell us what that is now. Is that too to want to know?
Mm-hmm. I think you're helping you realistic.
I guess there's some screening information, and again, there was some other good data, family engagement, and knowing how many families are served and what what they're being served with, what type of treatment or resource. Student attendance rates, which is something they already have. I want to know more about what their metrics are now, not what they will be in the future. That lead back to, and Lana had mentioned, he had referred back to Exhibit E, but I would like to know what that is and then have data points along one of those, and whatever that may be, if it's what they say that theirs is.
Where was that?
Just at the top, the category does this program fit into, and they've indicated prevention. So then within prevention, what is it that they want to do? And what metrics are they measuring themselves on? That would be my question to them. If they can answer it.
Yeah, sorry, some of that's answered under the evaluation method. Tracking the number of families served. Looking at the data from the PNA, the YRBS, monitoring the suspensions for alcohol and drug use, with their power school, looking at attendance data.
And Colleen, you might be able to ask this question in a better way. And I saw that, but what do they want? What do they want to achieve? What is their goal?
Yeah.
Not looking at it and seeing it, but what is the actual goal within that?
Yeah.
Well, okay, so in prevention, we look at data, we look at use numbers, and then you implement the program, and then you look at the data afterwards to see if you've made any changes. Have you moved the needle? Have we been successful in this? How many people, how many kids have we referred to treatment or referrals for families, which is can all be tracked through the Connect referral system. And I think ultimately the goal is to keep people from starting drugs. And unfortunately, there's not a way to track that. I mean, we say in prevention, we saved a life today, you just didn't see it. So the only way that we can track what we're doing is by looking at the data to see if use has gone down, if overdoses have gone down, if MIPs have gone down. I don't know if that answers your question.
You're getting to it, but I want to, just as with the last one, what is your goal? What is the goal of the district?
You want a quantification.
Correct. So if they're looking to reduce MIPs, are they looking to reduce it by 1 or 20% from 700 to 500? What is their goal? Not just looking at, because in their evaluation, it just says to track and to look at, but what are the actual goals?
They know if they're successful.
Yeah.
Not just reducing by what?
Yeah.
Not just referring by what?
Right.
And shows that information. It's all there now. They just need to compile it and start somewhere and tell us what their goal is. That's what I want to know.
Yeah. Yeah.
So
And
you're talking about the areas I'm curious about. I just want them to give us.
Right.
What's a baseline? How much is that baseline?
If Helena High has 200 MIPs this year, what is their goal for next year? Obviously 0, but what's an attainable?
Yeah.
ask them like a smart goal.
I
Yeah.
just wrote smart.
We need smart goals.
Yeah.
Mhm.
Yeah, because at first you were mentioning prevention, and you were I felt like you were asking, like, what does prevention look like? And I just saw on page 10, which is part of an appendix for additional information. They do get a little more into there what prevention is. So it's mental health support, integration, education. But you were going back to the goals, which I agree with 100%.
And then that will help us next year to determine if this has been with quantifiable, but also they're qualifiable. What did they do, and how were the families touched? And that is helpful and beneficial too. But I think we need something that's also numeric of what is the actual problem and where are we trying to get to.
So you're looking at qualitative and quantitative data in the end to see what's been accomplished.
And right now, all they have is possibly qualifiable, but nothing quantifiable.
Right.
That's where my score went down in theirs because I didn't see any of that.
Yeah, it's a little wishy-washy.
I think that there's a lot of good benefit. And one thing, but I got my answer question in it, or my answer question. My question is that the Helena School District doesn't integrate with DARE. Is that correct? There are no DARE programs in the Helena Public Schools?
Well, the old DARE program was really bad and actually increased use. And they have redone it, and I don't know where it stands right now.
That's, but I just understood that Helena Public Schools no longer participates in DARE. And so, and maybe that's a question.
Yeah.
Does Helena Public Schools integrate with DARE or utilize DARE? And if so, how do they integrate this with it? If not, then that answers the question. This would kind of be in lieu of a DARE program. So we want, if we were to fund this, that it's working against, not in conjunction with another program that's already there. Do you know if the Sheriff's Department, well, the Sheriff's Department is in some of the schools, Helena Police is in some of the schools. Is DARE in any of the schools, do you know, that are funded through the county, through the Sheriff's Department?
I don't know the answer to that. I know they do a program at Lincoln, but I don't know what.
I don't know either.
Yeah.
I know East Helena has DARE in the middle school, and the SRO is the DARE officer, but
Hmm. I don't know how big this page is, but it does not list Helena School District. It lists East Helena, Wolf Creek, Augusta, and Lincoln.
those are all the questions I have.
Other questions we'd like to have answered. Ready?
I'm sorry?
Yeah, other questions we'd like to have answered?
Oh. No, I don't think so. Not for me.
Okay. All right. So can we get those in the same time frame so that we could? All right, let's try for that. All right.
You got something else? Sure.
Just like clearly lined out all the way to the impacts. Let's do it. Yeah, because I think I like to see screening discussed in assessing progress, but I don't see a screening discussed anywhere else. Like not in the goals. I don't see like a goal around screening, and I didn't see a goal around program reach, and so it's just there's a lot here.
Yeah.
He didn't do it.
It was segmented in my head,
Yeah.
not cohesive. I can see the Sheriff's Department one being more cohesive. this one I felt was stronger in other ways, but it was just like a bunch of.
We've run some grants. I'm with you.
You want to read our questions back?
Yes, it was noted that there was a lack of clarity on the roles of the proposed staff. So looking for exactly what we're going to be doing with the program with respect to mental health and abuse. Actually, I'm going to jump down to another. What are the specific goals of the program? Percentages, numbers, and time frame. Providing baseline as well as whatever that complicated is. That's what we were initially talking about with establishment. Looking for more specifics on what metrics we'll be measuring. What are your specific prevention program strategies? Noted, what is your prevention program and how are you going to measure it?
I think more just the measurement. They do talk about what the prevention strategies are, but not the metrics of that.
And then lastly, does Helena Public Schools utilize DARE? If so, how will this program integrate with DARE?
Would you mind both these applications, writing up the questions and sending them out to us so that we're thinking about them and for the answers? And get a copy of it in there as well. Is that everybody feel comfortable with these questions? Anything else? Yes.
One item as we're working through this process, both Rusty and Stephanie seem very open to the idea that they may need to be adjusting applications as we move forward. If there's something like a very specific logic model, or you want this type of data collected on an application that will help our future deliberations, that's something we can ask for. So I guess I just am planting that seed specific that we would like to stop in your application.
It seems to me like the thing we're talking about is how do we judge whether we're being effective enough? And maybe numerical, let's say numerical indications of success.
Quantifiable and qualifiable.
There we go. Variable.
But also, and stating that there was another thing that you said that I wanted to.
I mean, I think they're open.
Yeah.
Especially, I think, for example, to have ask for specific amounts from each area as opposed to just blanket the whole state. That came, I think, from us. All of our questions. So
I guess making it clear, this is what I was thinking, was making quantifiable and qualifiable goals around the Exhibit E, around the benefits to the recipients of the services, where what I feel like I've seen a lot of is the benefit to the grant programs, not the what are the metrics behind the people that are getting the services. Yeah. For the people with the services, not the outcomes of they have 50% less transports. That's not the concern of what this grant funding is for. That gets to it, but that's not the point. So that, to make it clearer that of the, not the grant recipient, but the individual served.
Goals should be focused on
Across the board, I would love to see what's your sustainability plan? Like, we're gonna dump all, hundreds of thousands of dollars into this, and then when the money's gone, then what?
sustainability would be a good added section and evaluation metric.
Yeah. All right. Anything else we should do? Respond on to get back to the motion.
Carol also should have asked, you can see this in live form as we're asking. Live, but there's a way within the portal to be able to show that.
Yeah, I think that'd be really helpful.
And to allow the grant requesters to edit instead of having to resubmit this whole
History. Submission history in the software. But no, if you have to go find it, and it's not really super helpful. It just shows different actions going on different days. Started, submitted, revised.
Any other questions? Ideas on how we can help promote this?
I think we've been talking for a lot.
Nice job.
we have been, I think we have been the guinea pigs without being told.
Yes.
There are moments I felt that we've been a little bit of a.
It's been a good thing.
We can help them be better. Well, let's do it.
Yeah.
All right. Anything else? We had listed at the Montana Meth Fentanyl Project, but that's again a more general one. But that's our reason for not doing anything with it today, unless somebody has a okay. So we're set. Our plan is to meet on the 27th at 10:30. Hopefully have answers on one or both of these so that we can potentially make a recommendation to fund one or both of these. All right. Is there anything else that anybody wants to bring up? We're missing. All right. We'll open it to public comment. I don't see any public online. And we have no public here, but we will ask. Nothing else? We're adjourned. Thank you, everybody. Thanks
See
for
ya.
coming.
Bye, Colleen.
Thanks for being here. We appreciate it.
Sorry, it wasn't better help. The audio did not help when I got on my computer.
Thank you for
Yeah.
being